Hello guys, welcome back, and today we are going to discuss about nursing diagnosis and care plan for dementia. Okay, so we will see some of the main important diagnoses which you can write in your dementia nursing diagnosis and care plan. So the first one is impaired memory related to central nervous system changes secondary to degenerative brain disease as evidenced by reported experience to recall recent events. Second one is disturbed thought process related to cognitive impairment secondary to dementia as evidenced by difficulty in handling complex tasks, confusion, and disorientation. Third one, impaired physical and mobility related to dementia as evidenced by problems with motor functions, disorientation, and confusion. So while writing your diagnosis, think about your condition, think about your diagnosis. That means think about your condition. In this case, we are talking about dementia. So understand the etiological factors and signs and symptoms of dementia first before going to write your nursing diagnosis. So these are all uh, some of the important nursing diagnosis and nursing care plans we are discussing. Okay, so first we will talk about impaired memory related to central nervous system changes secondary to degenerative brain disease as evidenced by reported experience to recall recent events. So while writing a care plan, as I said, you have to write this column like this: assessment, diagnosis, planning, a rational, implementation, and evaluation. Okay guys, so first thing is assessment. In assessment, you have to write subjective data and objective data. Under subjective data, what the patient is saying, and under objective data, what you are observing. So subjective data is patient daughter complains that her mother is forgetting and misplacing the items. In objective data, you can write like patient looks dull and injury on body but could not recall the incident. While coming to the diagnosis column, you can write the diagnosis. Okay, impaired memory related to central nervous system changes secondary to degenerative brain disease or dementia as evidenced by reported experience to recall recent events. And while coming to the goal, you can write the patient will be encouraged to perform daily activities of living. While coming to the planning, you can write these plannings. Okay, do history collection and physical examination. Okay, for what? To understand the general condition of the patient. Done history collection and physical examination. Then do mini mental status examination and process recording. Okay, to understand the present mental stage of the patient. Completed mini mental status examination and patient is not oriented. The result also you can write in implementation. If you open the what case sheet of the patient, you will see the result of this mental status examination, history collection, and also you can add that result also in the implementation. Then provide dressing and wound care because the patient got injury, so to avoid infection. Then in the implementation, you can write provided wound care and dressing. Then educate the patient about using call, switch, or light and bed or chair alarm. That means the patient is on bed and forgetting everything, means at least educate them to use how to use the alarm, switch and alarm, light alarm, etc. to improve the coordination and independence of the patient. Educated and showed and practice the method of working of alarm. Then reorient the patient when the patient presents with confusion to reduce the confusion, and reoriented, repeated the activities and command to avoid confusion. Encourage the patient to be independent in activities of daily living. For what? To improve the physical and mental health. Encourage and help the patient to perform activities. Provide medication as per the doctor order to reduce the symptoms. Provided medication. And in evaluation column, you can write the patient started to perform activities of daily living to some extent. Then next care plan is impaired physical mobility related to dementia as evidenced by problems with motor functions, disorientation, and confusion. Subjective data is the patient says that he can't remember anything, okay, or he is not oriented. He don't know where he is. Whatever the patient is saying, that you can write in subjective data. There is no format for that. Then in objective data, you write the patient looks disoriented and staying alone. If it like staying alone in a place because he's disoriented. Okay. Then diagnosis impaired physical mobility related to dementia as evidenced by problem with motor functions, disorientation and confusion, impaired physical mobility related to dementia, as evidenced by problems with motor functions, disorientation and confusion. Goal: the patient will learn simple exercises and start to indulge in daily activities. That is our goal. Then, while coming to the planning, you can write do history collection and physical examination to understand the condition. Done. Okay, done physical examination or completed physical examination, like that you can write. Do process recording to assess the communication level. Completed the process recording. Assess the patient's level of mobility and ability to perform activities. To assess the improvement of the treatment. Assess there is improvement in treatment. Encourage the patient to involve in activities to promote self-esteem. Encouraged the patient to patient started to cooperate with activities. Give simple task and single instruction to complete the task successfully. Given and the patient started to complete the task slowly. Teach how to use alarm switch and ensure safety. For what? To ensure health and safety. Taught and practice how to use alarms. Perform range of motion exercises or ROM to improve the muscle strength. Performed range of motion and the patient started to do that. Schedule time for physiotherapy to improve condition. Scheduled and noted in the care notes. Provide medication as per doctor's order to reduce symptoms given as per the doctor order. The patient started to involve in activities, range of motion exercises, and daily activities to some extent with the support of the caregiver. So, what evaluation you have observed, that you can write there in the evaluation column. Okay. So, these are all the care plans which we can use in dementia, okay, in your exam. So, for this impaired memory related to central nervous system changes, as evidenced by difficulty to recall the events and disturbed thought process, okay, related to cognitive impairment, related to confusion. For these two things, the same plannings we can use. And this the second one is for impaired physical mobility related to what? Dementia, as evidenced by disorientation. So these are all the important care plans and nursing diagnosis which we can use for what? Dementia. Okay, guys, hope you understand. Okay, next week we will discuss another condition, another nursing diagnosis, and another care plan. Okay, thank you.